Regular physical activity can help in an assortment of daily pain, but knowing when and how to exercise can help you reap all the benefits.
And here to test our knowledge in a TMS Fitness Trivia Challenge is chiropractor Stephen Gray. Stephen, good morning.
Good morning. Thanks for having me back.
All right, well, good to see you again. Let's dive right in. What is question number one?
Okay, question number one is a true or false. So true or false? People with joint degeneration should avoid physical activity.
Oh, false. False, right?
100%.
Yes, so the answer is false. So think of joint degeneration for your joints as wrinkles are for your face. So it's a common misconception that when your joints are degenerating, you should minimize your activity. And the opposite is true. So according to the UK's NICE guidelines for osteoarthritis, which is a fancy word for joint degeneration, people with joint degeneration should increase their exercise. So you're looking at both aerobic and strength training. The strength training is going to help stabilize those joints that are getting degenerated, and the aerobic training is going to lighten the load off those joints and make activities just a little bit less painful. So when all else fails, remember the slogan, motion is lotion.
Okay, I like it.
All right, I'm writing that down. That's good. Okay.
Okay, on to the next question. So this one is for my pregnant patients out there. So it's another true or false. True or false? During pregnancy, physical activity should be limited to 60 minutes per week.
False.
False? Okay, false.
You two are too good. Yes, you are correct. False. So according to the 2019 Canadian guidelines for physical activity throughout pregnancy, all women who are pregnant without contraindication, so that's a fancy word for a medical condition that your doctor advises you not to exercise, should remain active throughout their entire pregnancy. This even includes women who were previously inactive before becoming pregnant. This exercise can look like yoga, can look like jogging, dancing, aerobics, swimming, indoor cycling. You have a ton of options, and you're looking at about 150 minutes per week. So spread this over 3 days, ideally more. Also, you can consider some pelvic floor exercises, and I'm going to take you through one right now. Really easy. It's the elevator exercise. So sit up tall in your chair, and I want you to think about the muscles between your sit bones. So those muscles are going to be the floor of your elevator. So I want you to contract those muscles and lift that elevator up to the 5th floor. Good, and lower back down to the 1st floor. Lift it up to the 8th floor. Relax on down to the 6th floor. On to the 2nd floor. And back down to the ground floor. Good. It's as simple
I'm
as
much
that.
better at the ground floor, Stephen. And really, I think this elevator only rides to about the 5th floor.
All right, on to the next question. So this one has to do with headache and neck exercise. So it's another true or false. Neck exercises can help with many types of headache. True or false?
Yeah, I think true, right? Sure. Increase the blood flow?
Yeah.
You are 3 for 3. Yes, true. So according to the Neck Pain Task Force, basically light exercises using the muscles between your head, your neck, and your shoulder blade can help alleviate many symptoms for both tension type and cervicogenic headache. So cervicogenic is just a fancy word meaning a headache that's kind of radiating forward from a structure in your neck. So a muscle, a joint, a ligament in your neck that's irritated, and that pain is radiating and causing a headache forward. So I'm going to walk you through one of those exercises that I often prescribe my patients. So first of all, sit up tall. Next, you're going to make the dreaded double chin. So just imagine you're taking that selfie with your camera phone for the very first time. Retract that chin. Take two fingers.
This is my best exercise, by the way.
Take two fingers and place them on the side of your head and resist pushing in. Good. And try the other side. And resist, resist, resist. Good. And last one, forehead. Resist, 2, 3, and relax. So you're looking at doing those 10 times a day, once in the morning, once at night. And that's really going to strengthen your deep neck flexors, which you can kind of think of as your core for your neck, the muscles you want to be using when you're doing anything with your neck. That's going to help with some headache.
Interesting.
Okay.
All right.
On to my next question. This one's a multiple choice, not to throw you, but for mechanical low back pain, which form of training is preferred? A, strength. B, range of motion. C, aerobic. or D, all of the above? Got to throw in that all of the above.
I was leaning towards strength training, but then when you throw in the all of the above,
I'm feeling all of the above.
I know.
Here. Yeah.
Okay, who gave you the answers before time? Seriously. Yes, all of the above. Okay, so according to the Canadian Chiropractic Guideline Initiative, basically any form of exercise is recommended. This is good news because that means at home, supervised, group, or alone. So those of us under lockdown, you can get this exercise while at home because you are at home. So that means signing up for that group exercise, fitness class, dance class that's virtual, signing up for that one-on-one personal training, or if you're really not sure where to start with that one-on-one virtual telehealth with your physiotherapist or your chiropractor and get that knowledge that you need to start that right foot forward, getting active. Really going to help with that mechanical low back pain and really get you functioning well.
All right, Stephen Gray, such great information. By the way, we went perfect on the quiz. You'd think we'd be in better shape.
I was just going to say, now we just have to implement it. We know what to do. Now we just got to start doing it.
Stephen, great to see you this morning. Thanks so much.
Thank you.